Hi, my name's Phil. I like talking about politics. And did you know that a bit over a decade ago, the IEA, which heavily influences Conservative policy, wrote a paper that argued there should be no such thing as qualified doctors, that everyone should be able to practice and that the good doctors would just get good reputations and the system can work on that basis. And did you also know that the Tories look like they were slowly putting this policy into practice with the use of PAs or physician associates? Now, this isn't bashing the potential use of PAs, by the way. It's more the way the Tories were trying to use them. And now Health Secretary Wes Streeting has ordered a long overdue review into their use because there are serious concerns that at best NHS patients are being deceived and at worst patient safety is being compromised. But first, for daily political commentary, please click the subscribe button so you don't miss out. So let's start with what this row about the role of PAs is and then move on to the extra context, which almost nobody is talking about. So PAs, or physician associates, are supposed to work alongside doctors. Now, they're qualified, at university level. We're not talking people who did a 2-day seminar here. So they have training and skills and so can absolutely have a place in plugging gaps in the NHS. There are some roles, for example, that a physician associate will be perfectly competent to carry out, and you can leave our already too few doctors to focus on what they alone are qualified and experienced to do. The general concept is absolutely fine and dandy. So where's the problem? The problem is that PAs are reportedly being used to do things which they are not suitably qualified or experienced to do. It's a bit like if I give a parallel from my old profession, teaching. So you have teaching assistants, incredibly useful, very valuable, but not teachers. So what they shouldn't be doing is taking classes of their own. However, because of cuts to the education budget from the Tories as well, what you often find is that TAs would actually take small groups of children out to do little lessons with them, at which point they were teaching. That's not supposed to happen. And that's the issue with PAs, that they are sometimes doing a job that only doctors should be doing as a result of pressures in the NHS and too few doctors. They are not supposed to be a substitute for doctors, yet there are worries that they are being used for that. That is, to tackle the shortage of doctors, PAs are being used to replace rather than supplement. And that there was a worrying trend that the Conservative government saw advantages in not putting efforts into recruiting doctors, but being fine with the much cheaper PAs filling in the recruitment gaps. Most Tories, after all, have private healthcare anyway. And if this sounds far-fetched, I would like to refer you to a paper published by the IEA in 2012. Now, these people have been very influential on Conservative policy. They are the ones who gave Liz Truss her economic education. They are the ones behind the mini-budget. But it's not just Truss. Lots of senior Tories have close links with them, including the current Tory leader, Kemi Badenoch. So what was it they said in 2012? Well, the blog was titled How to Abolish the NHS. So yeah, no hiding their aims at all there. And one of their actions was, and I quote, "Perhaps most importantly, the compulsory licensing of medical professionals should be abolished. Anyone should be at liberty to practice as a doctor or nurse, with patients relying on brand names or competing voluntary associations to ensure quality. Ending current restrictive practices is essential to enable private firms to increase productivity in the sector." More on that last bit in a minute. But, you think about this blog. You think it was written by a think tank which has heavily influenced Conservative policy for a long time, and where people have concerns that PAs are often doing the job of fully qualified doctors. Are we really saying that PAs look to be working a little bit outside their boundaries of competence just because of NHS pressures? Or is it more likely that the Tories have deliberately created these pressures, implemented PAs as a sort of pressure valve with the long-term intention of doing without genuinely qualified doctors altogether? Remember Sunak's plan to curtail the training even of doctors that were needed to qualify? So now Wes Streeting has ordered a review into PAs and their roles within the NHS. The review is going to look at patient safety, but also informing patients, because one of the criticisms has been that patients sometimes dealing with a PA think they're a doctor when they're not. But they only have 2 years of medical training, considerably less than a doctor. So it should be obvious that a PA can only do a fraction of the work a doctor could. And as far as I know, there is no further training pathway for PAs once in service. But doctors carry out years' worth of extra education in order to then train as surgeons or GPs, for example. And as I say, this is not saying that PAs are a bad idea. The official idea behind them absolutely makes sense to me. We don't have enough doctors, and some of the things doctors do, yes, I can believe can be done with people who have 2 years university training. I can believe that. So using PAs to carry out those duties, leaving doctors for the more specialised stuff, that is more efficient. But like I said, when you consider where the Tories stand on the NHS and what the IEA have been pushing for over a decade, it seems very likely to me that the Tories did not introduce PAs for the reasons stated, which are perfectly reasonable, but for a far more insidious purpose. As the IEA said, it would be a way to let the private sector pay less for medical staff. It's not just about the NHS, it's in tandem with the private sector. After all, how do you abolish the NHS? First of all, you have to get relatively few people using it to the point where we say, well, we don't really need it anymore because everybody's using private treatment. So the idea was, and they said it themselves, it's explicitly made, private healthcare providers would therefore be able to hire these PAs, much lower cost to doctors. That means they can offer their private healthcare more cheaply, attract more people to use private healthcare because a lot of people are already doing that right now anyway because you can't get NHS treatment. And that will then make it easier to argue for the NHS to be abolished because as soon as you've got key swing voters not using the NHS anymore, they're using private healthcare, at that point it becomes way easier to just say, let's do away with the NHS. And because of the way it's worked out, as Streeting said, actual physicians feel like they're being ignored and physician associates are feeling demoralised. Of course they are, because everyone's sort of thinking they're the bad guys when they're not. It's just that their role has not been clearly demarcated. What needs to happen is you need that demarcation of what is and is not appropriate for a PA to do. That way, there's no risk to patient confidence or safety, and we don't end up with the public turning on the idea of PAs because they are a good way to improve efficiency if used in the way that they are supposed to be used. But it's only if they're used in the interests of healthcare, not in the interests of those who want, in their own words, to abolish the NHS. Let us hope the review does not take too long. But there we are. Those are my thoughts. Let me know yours in the comments below. If you enjoyed the video, please click the like button. If you'd like to support the channel further, you can join for memberships. Thanks for watching. And until next time, I'll see you later.